Right now, Dr. Tosin Taiwo, GP Registrar, Queen Elizabeth Hospital, King's Lynn, joins us via Skype. Thank you for joining us at this time, Dr. Tosin. What's your observation and assessment of the lockdown measures in the UK? Would you say that it is time to relax the measures?
Thank you for having me. With things presently, we are working to look at how we can do that. It's probably going to take another 3 to 4 weeks before we get there, but we do need to start relaxing measures for people to start getting out and start getting back into the activities that we know. Like we all know, we are about 3 or 4 weeks, 3 weeks behind Italy, and Italy has started relaxing their measures. But there is an exit strategy that the Prime Minister is going to broadcast probably next Sunday that will lead the way to this.
What do you think about Nigeria's measures, seeing as we started relaxing our lockdown for, some major key cities?
Yes, with Nigeria, some of us honestly feel it's a bit too soon, but given the situation back home with a lot of people crying with terms like hunger virus, it's something that has to be done. But with the good news on the horizon, with the discovery of probably a new drug that has shown promise, that may be a key issue for Nigeria.
Tell us, we understand UK scientists developed a new coronavirus antibody test. They're saying it produces results in 35 minutes and it's 99.8% in terms of accuracy. How important is this in the fight against COVID-19?
That's a key step. It's an antibody test developed by, I believe it's Roche Diagnostics, and they said that the specificity for the test is 99.8% and sensitivity is about 100%. What that kind of tells us is that it can accurately tell us who's got the infection and who hasn't. So it's quite good. If we can roll that test out, we can get a lot of people tested, and with that, you know who's not infected, who has been infected, and who is presently infected.
Looking at the global fears that we might live with this virus for some time, how easy do you think it will be to changing one's lifestyle?
That's a good question. It's quite unpredictable. I think the CDC, if I'm correct, has said that it may be with us for at least 2 years. So we will experience a surge. Lifestyle-wise, I can't really predict as to how that will turn out. Obviously, there's going to be the new norm of people wearing face masks, which I probably think will probably be the new fashion accessory that everybody has. But social distancing in place, we will have to modify it. Taking the airline industry, for instance, they're putting things in place to go with that. But it is very unpredictable to see how it will turn out.
Let's get your point of view. We hear the UK is experiencing problems with expanding testing to about 100,000 tests per day. Why does there appear to be a problem so far?
Yeah, with the testing, the way it's going so far, they are getting 100,000 tests, but the catch there's one thing to test people, but getting the test you've done to the lab to analyze it. Remember, this is not the rapid antibody test that we are doing. It's still the nasal swab that they are sending. So the tests have to be taken and taken to the lab. So although they may take 100,000 tests in a day, they probably will not get that same amount of processed. The figures that we have say that, I think as of yesterday, they did get up to over 100,000 people tested, but the results that will come out may not be that fast. So that's probably why. There was an issue with capacity, but I believe they are on top of that now.
From the Nigeria Center for Disease Control, the DG said since the onset of COVID-19, we're committed to following the science, and the clinical trial of remdesivir seemed to be showing promise, saying the next step is to make the drug available. What are your thoughts on that drug?
Yeah, the trial that is conducted in Chicago, it's actually done by a colleague and cousin of mine. He has produced the thing and was published. I think he talked on CNN about the promising trials that they've done. They've had good results. I think the key thing now is how Nigeria goes about acquiring the drug and making it affordable to the public, because it will probably still be under patent. That might be a bit difficult for Nigeria.
But then you're saying it's an important step.
Pardon? Sorry?
You're saying that it is an important step.
It is an important step, most definitely. But it's how it will be roll it out to the grassroots public to give everybody the drug if they need it.
Talk to us about the efforts, your thoughts about the efforts, because we have several state governments that are taking different measures with regards to curbing the coronavirus pandemic. I'm sure you've heard about what's happening in Kano. At some points, they talked about unexplained deaths, but now those deaths have been attributed to COVID-19.
Yes, from what I can see, in Kano State, there was a bit of a backlog in people catching up with the idea that social distancing and testing was necessary. With what's happening now, I initially thought Kano might be the second epicenter, which actually it is, and they've not been able to quite get on top of it as quickly as other places. What I want to know would be how the healthcare professionals are faring there, whether they do have enough capacity to manage the current situation in Kano.
Interestingly, we also have two states that appear not to have any confirmed case of COVID-19. That's Cross River and Kogi. Do you think there might actually be cases, and perhaps because we're not testing enough yet, or that they probably have, been the lucky ones?
More than likely, they do have cases. It has to do with the testing capacity. With the way they think it's a highly contagious disease, and it would have spread to every place. It's highly unlikely that they do not have any tests, any confirmed cases. They just have to probably ramp up their testing.
All right, we appreciate your time, Dr. Tosin Taiwo, GP Registrar, Queen Elizabeth Hospital, King's Inn. Thank you for joining us on the program.
Pleasure to be here.